Universal health care is a dream, where no one is denied the treatment they need. But right now, millions of people are suffering in silence from preventable diseases such as HIV and TB. People don't have access to the most basic services, let alone treatment. Access to diagnostics is essential not only for ensuring treatment of individual patients, but also for disease surveillance and taking informed public health decisions.
Since 2016, FIND has been working with LLamasoft and Ministries of Health in multiple low and middle income countries to perform diagnostic network optimization exercises using the LLamasoft proprietary software. Patients don't normally go for health services where diagnostic services are available. Diagnostic network optimization is working with countries to make sure that those diagnostic services are available where patients go for care.
Diagnostic network optimization, it's an innovative approach, and it can help countries identify gaps in their diagnostic services and then understand how they might fill those gaps.
In 2016, the prevalence survey showed that we had close to 43% of patients being missed from being diagnosed. The network optimization, at the end of it, once we completed the exercise, was able to help us to get data, which we used during the strategic plan process. Once we introduced the diagnostic optimization, we are now able to know the various turnaround times for sample transportation. Like now, we have already managed to disseminate the specimen referral guideline, which we developed from network optimization, into a number of counties. Our plan is to ensure that the country has enough access and capacity so that clinicians are able to get their results within the shortest time possible. One of the challenges is to reach to the remote areas, so our plan is to increase and scale up the number of platforms we use in these areas so that we can shorten the turnaround times for sending samples and referring patients for accessing care.
So this approach really helps countries to connect the dots across multiple different sources of data. And in doing this, it can help them design overall a better system, ensuring more equitable availability of services across a country. It can also help to understand how to most efficiently invest in improving the health system infrastructure.
FIND and LLamasoft collaborated with the USAID Procurement and Supply Chain Management Program to develop OptiDX, which is an open access software that will be available free to countries to use. So they will be able to use national data to optimize their own diagnostic network to increase patient access to services.
We wanted to allow country decision makers to run these analyses on their own. To begin their journey, here is where a country would upload their data using Excel files. For that, we needed something that would be user-friendly, very easily accessible, therefore we built it to be web browser accessed. You can review the current state network, you can change the network, and then you can compare network outputs to help you select the best network design for your situation. The beauty of it is that it's not limited to any one disease area. We've worked with HIV, TB, hepatitis C, but it's not limited to any of those. You could examine diagnostics for any number of disease areas or look integrated across all disease areas.
OptiDX is being piloted and it'll be made freely available to low and middle income countries in 2021. By building integrated systems and sample referral networks, OptiDX can not only help improve access to services, but also improve efficiency of service delivery. In turn, this will help remove barriers to diagnosis and treatment, enabling better outcomes for the whole population.